Welcome back to Living 757. This is actually one of my favorite segments because we have the chance to salute our healthcare heroes.
Absolutely. This is in partnership with Coastal Virginia Magazine. So without further ado, first up, we have Dr. Stephen Bronaugh. He spent 10 years flying for the U.S. Navy. So we salute your service, sir. And when he got out, he decided to go back to medical school to get his MD. He's still sticking to his Navy roots because he is now working at Portsmouth Naval as an anesthesiologist, which means he is administering the drugs. He likes to build Legos with his kids. He loves to go bike riding as a family, and he enjoys a good glass of wine with his wife. So we salute you, sir. Thank you so much.
That's right. And the next one that we're going to salute is Dr. David Jones. He's board certified internal medicine and pulmonary disease and critical care medicine. Now, he actually got his degree from the University of Virginia. And after completing his residency in internal medicine, he actually moved to the pulmonary and critical care medicine fellowship in Wake Forest University. So what's interesting about this awesome hero here is that in the critical care at Riverside Memorial Hospital, that's on the eastern shore of Virginia, this is where he practices all of his stuff. And he enjoys teaching students, medical students, actually at the University of Virginia. So he's an assistant professor of medicine and instructional faculty there. So Dr. Jones has also been instrumental in dealing with COVID-19 pandemic with the patients and testing. So we salute you for, just taking the time to just do those things, Doc. And just keeping everybody safe here in Virginia. So thank you. Saluting you once again.
Yes.
Jones.
Yes, thank you so much to all of them and also to Coastal Virginia Magazine because we are partnered with them and we have the chance to salute them every week. So yes, thank you so much for your effort and your work.
Yes, thank you so much. Now, when it comes to child welfare, ACEs is an important term to know. And Patricia caught up with Keith to learn more. Let's check that out.
As a child, you can experience traumatic events that can affect for the rest of your life. To talk about this, let's welcome Keith to help us a better understanding of what ACEs is all about. Welcome, Keith.
Hey, good to be here.
Yes, we're so excited to talk about this point. And first, in first 10, what is ACEs and what does it stand for?
ACEs stands for Adverse Childhood Experiences. And the original ACEs study, which was done back in the early 90s, defined ACEs really as 10 forms of adversity that may happen in a child's life. And they were 3 forms of physical abuse, 2 forms of emotional abuse and neglect, and then there were 5 forms of household dysfunction. But really, adverse childhood experiences are anything that can happen in a young person's life at a time when their brains are really developing. It's a critical period in their life that can have long-term impacts if things don't go well, if they don't have the sort of meaningful relationships connect at that time. And so this adversity really stands in the way of that, but those are adverse childhood experiences.
Yes, that's a very important point that you just mentioned it because, this is affect the child, also the family completely, I believe. So can you give me some examples of ACEs?
Yeah, so any sort of, if a young person witnesses any sort of domestic violence in the home, there may be substance abuse going on in the home, any type of physical abuse, sexual abuse, any sort of neglect that's taking away from meeting a child's need. Those are all sort of things that are adversity that's really hard on a young person at that point in their life.
Yes, when they experience all these events, it can be traumatic for the rest of their life. So, of course, they have consequences. How we can help these kids, or how is the treatments to help them?
Well, I always say the cause and the cure are the same thing. So what really leads to these adverse childhood experiences are the most meaningful relationship in their life being harmed or severed at the most important time in their life. What can help a young person as they're growing older then? Finding a meaningful relationship. What these young people end up with is a life of not trusting the people around them. And so that they end up acting out in school. They end up having all sorts of challenges trying to make up for that. So that's where mentor programs are really valuable, connecting with anybody in a meaningful way where they can start to build trust with adults again is one of the biggest first steps. Without that, nobody's going to be able to teach them the sort of skills that they need to learn how to better regulate their emotions that get out of whack during these adverse childhood experiences, to help them overcome some of the other developmental issues that are part of these adverse childhood experiences. Relationship.
And relationship communication, of course. And so we can say that these child, so anyone affected by these can have hope if they leave ACEs. Of course, the time is flying here. Where we can find more information, and really quick, if you can tell me which areas do you cover?
So Hampton is one of them. You know, they're one of my favorites because they are big with this work. I see my emails on the screen and the phone number there. I will say yes to anything ACEs. So feel free to reach out by email or by phone, or contact my wonderful friends at Hampton. But we spread this information all over the state of Virginia.
And that's what it's all about. Like, I try to share the information with all Hampton Roads. Well, thank you so much, Keith. This is a great information, and I hope we can help, like I just say, be kind to one another and understand more about ACEs.
Well said. Thank you.
Well, thank you so much.
Yeah.
Patricia, that was good. That's very good information on that, because the one thing that I think a lot of people miss when it comes to just people in general is you don't know what people are going through. Well, people forget about kids. You don't know what kids are experiencing in their own home. So
yes, and like I keep just say, these kids are exposed to very traumatic events that they can affect for the rest of their life. And what they're doing is to help not just the kids, also the families. So I really want to say thank you to Keith, and also to the Hampton Newport News Community Service Board, because they are the one putting this message out there for our communities. So I think it's great. And once again, thank you so much for your teamwork. And yes, like I just said, Quincy, we never know what the family is going through.
It was hard to even watch some of that B-roll. Like, even knowing that it was kind of, staged, then they were like acting, it was hard to watch.
Yeah. And the one thing that we definitely know is that there isn't any acting like in this, in real life. So, so thank you, ACEs, for what you guys do. And thank you for that.
Yes, and the most important thing here is to know about ACEs, that like it is a program, it is hope for those kids or for anyone involved in these kind of events. So, yes.
All right, great. All right, well, I know that we got something coming up next, right?
We do.
Yes, coming up next, we are taking a walk in the park. Yes, I think we're going to have a tour coming up next. From Galway.